Good afternoon, everyone. Thank you for joining me for the Salisbury University's first official COVID-19 weekly briefing. There's a lot of information out there, and I want to use these live briefings as an opportunity to speak directly to members of our community, to update you on what's going on, to help you keep safe, and to answer any questions that you may have. If you have questions during this briefing, please email them to us at stayinformed@salisbury.edu. We're checking that account live in real time, and we can respond to your questions at the end of the briefing. Each week, I'll be joined by university leaders, members of SU's COVID-19 task force, and local health experts and medical professionals to help me provide you with important information. Joining me this week is Dr. Stephen Leonard, President and CEO of the Peninsula Regional Medical Health System. Dr. Leonard, thank you for taking time to be with us today. So the first topic I want to cover today is testing. At the end of July, the University System of Maryland announced that all students and employees would be required to have a test, a COVID-19 test, within 14 days prior to their return to campus. Now, at the time of the announcement, we had a number of faculty and staff who had already returned to campus to work or who never stopped working on campus because of their job function. Those employees were encouraged to get a test as soon as possible. For students and employees who have yet to return, we're encouraging you to get tested in your home county and provide the results, written results of course, to SU on or before August 28th. If you cannot get a test at home, the university still has more dates for free testing, and you can sign up on our website. Now, starting Monday, August 31st, if you are returning to campus and do not have a negative test on file at SU, you will not be allowed to attend classes or access campus facilities. Let me just say that one more time. Starting Monday, August 31st, if you are returning to campus and don't have a negative test on file at SU, you will not be allowed to attend classes or access campus facilities. So get the test and get it soon. Now, I know we have a number of employees who are teleworking and students who are learning from home online. Are you required to get a test? Well, the simple answer is no, you're not, as long as you know with absolute certainty that you won't be coming to campus at all this semester. But free testing is available to all students, faculty, and staff, regardless of where you're working or learning. So if you change your mind and need to come to campus, you'll need to allow enough time to get a test scheduled and receive the results before you return. Starting in September, we will perform up to 1,000 free COVID tests every week to monitor the spread and positivity rate on our campus. I'll talk about the weekly testing a little bit more in a minute. Now, everyone who is tested is expected to use the screening app from the point they receive their negative test so they can monitor any potential symptoms on a daily basis. The SU mobile app is freely available in the App Store and on Google Play. It's a free download. Students and employees are required to screen every day before coming to campus. And even if you're not coming to campus, we encourage you to screen and monitor your symptoms on a daily basis. So if you do become sick, we can help you to get the resources that you really need. Okay, back to testing. All of SU's testing results are being reported on a dashboard, which is created by the Eastern Shore Regional GIS Cooperative. That's an agency we're really lucky to have right here at SU. The current dashboard is on display right behind me. It's also viewable on SU's COVID testing website. The dashboard will show us the number of tests, new cases, and positivity rates. It also will show comparisons to previous weeks and to state and local positivity rates. Currently, we have some data from the initial SU testing dates. As of this past Monday, we have tested over 2,000 faculty, staff, and students, and the current rate of positive tests is less than 1%. That's a great start. but we still have a lot more test results to receive. I cannot emphasize enough how important it is to abide by health and safety guidelines to maintain this really good trend. Now, in addition to testing results, which will show us current infection rates and positivity rates, we will be monitoring other key indicators as we make decisions about levels of operation on our campus in the best interests of the campus and greater community. One such indicator is case clustering. That means looking at patterns of spread of the virus through contact tracing. We will also be looking at capacity indicators. This means monitoring our capacity for testing, our capacity for student health services to see patients, and the spaces that we have for quarantining and isolating people who test positive or come into close contact with people who test positive. Obviously, if we start approaching those capacity limits, that's going to be a problem. Another indicator is regional care preparedness, which Dr. Leonard will talk more about in a moment, and conditions locally and across the state. We've been, and we will continue to be regularly monitoring these indicators in partnership with the Wicomico County Health Department, the University System of Maryland, and the State Department of Health. Finally, we'll be monitoring compliance with public health and safety guidelines. This means, is everyone wearing a mask, maintaining physical distancing, and following social gathering limits? I want to say that hundreds of SU faculty and staff members have been working incredibly hard since last March to provide the safest possible environment to learn, work, and teach back on our campus this fall. But ultimately, it is up to each of us as individuals to protect the flock and slow the spread. All of our planning goes out the window if members of the campus community engage in unsafe behaviors. That's why I am counting on you to make the right decisions when you're deciding how to spend your time both on campus and off campus. This means traveling and hanging out in pods or in very small groups so that you're not being exposed to the virus or potentially exposing others. It also means staying on top of the things that we know help to mitigate the risk of catching or spreading COVID-19. This includes wearing your mask, staying physically distant from others, especially those outside your pod, and practicing good hand hygiene. My pod consists of 2 people, me and my wife, Victoria. Everybody else gets 6 feet and a mask between us. That's the way it should be. We are already witnessing and learning from the experiences of other campuses that have reopened and then immediately had to pivot to send students home and move instruction online. Curbing parties and large gatherings is absolutely essential if we are going to be successful in these efforts. Really, there's no other way around it. As our campus population increases, there will be some cases of COVID. That's to be expected. But we need all students and all faculty and all staff to do their part to help stop the spread. Now let's talk about training for a moment. To make sure everyone understands the most current public health guidelines, SU has developed a coronavirus awareness and prevention training that all employees and students are required to complete before the semester begins. This will help all members of our campus community to have the most up-to-date information about COVID-19 and understand and pledge to abide by specific SU expectations and protocols for health and safety. The training module will be available in my classes starting Monday, August 24th, and it must be completed by Friday, August 28th. That's a pretty short turnaround time, but the training is brief, and we want to make sure that it's fresh on everyone's minds as you return to campus. Watch your SU email for more information on the training. Okay, we have been checking the Stay Informed email, and we'll respond to some of your questions at the end. Be sure to send them in if you have questions right now. But at this time, I would like to introduce Dr. Steve Leonard, who heads PRHS. Dr. Leonard, I'd like to ask you about a couple of things in particular. What can you tell us about hospital capacity and improvements in healthcare? I'm sure you and your team have learned a lot over the last several months in dealing with COVID-19.
Sure, Dr. White. Thanks for having me, and we're glad to be able to take this opportunity to provide information. I think it's pretty natural that people, as they head back to school, have questions about healthcare in general. And if you're sending obviously your child to school, you want to understand what kind of healthcare is being offered in the region of the school. I did put together some slides, if the team could put some of those up there, just to kind of give you an overview of what Peninsula Regional Health System looks like. I think when most folks come to Salisbury, they might actually be surprised at what type of facility is actually just up the road from the campus. As a health system, we cover about 7 counties, both in Delaware, Maryland, and Virginia. We consist of 2 hospitals, about 5,000 folks, and about 750,000 people. It is the largest regional facility, regional system in the area. The hospital directly up the road from campus is quite experienced. It's Peninsula Regional Medical Center. We've been in existence since 1897. It is a tertiary care referral facility, so we are skilled and equipped to take care of the most complicated presentations that you might find in any hospital, short of something along the lines of Johns Hopkins. So we've been around for quite a while, and needless to say, COVID was very much on our radar, and we have prepared for it and worked through the process. I think what folks might not understand, which is great for our community, is we are a regional trauma center for the state of Maryland. We're one of a handful in the state that is specifically designed for this. But what's interesting is that we were also an Ebola facility prior to that, a regional Ebola facility back when that was the last threat, you might say. So that has equipped our facility to, I'll say, manage a presentation like this, quite frankly, different than most other facilities, if not almost all other facilities out there. When COVID came about, obviously, like all hospitals, we were focused on making sure our staff were prepared. And because we were an Ebola regional facility, we had specialty training and quite a bit of specialized personal protective equipment. We never ran short, and our team was always safe in the process. From a capacity perspective, I can tell you that normally we have about 300 to 400 beds in this facility at a time occupied. And during the height of COVID, we actually had the ability to take up to 500. And in the end, we actually saw much less than that. Our clinical team was busy doing research on how to best manage it. And I think what I usually tell people, and like Dr. White has said very well, is you have to be cautious about transmission. But I think what's happened over the last several months is physicians have become much better equipped to manage it should people get it. Again, remember, the vast majority of folks ultimately never experience symptoms. But even now, if somebody does get it, hospitals, and especially us, we're very well equipped to manage it. So much so that the National Institute of Health came and spoke to us about exactly what we're doing it, because our outcomes have been recognized nationally. So we continue to focus on that, and we continue to focus on ongoing communication. I often find that the more information out there, the better, and people end up hearing that organizations are doing well and communities are doing well, even though it's there. And at the peak of it, I will let you know, we had about 130 positive patients and 70 pending results at all times. That was well below our capacity, and that was actually all the way back in April. Since then, we've almost taken care of almost 900 patients. But since then, we've been trending between 10 and 20 inpatients per day at PRMC, and we manage it much like any other infectious disease. We've been dealing with disease for 120 years, and I think we've gained quite a bit of experience with this, and it's there. And as Dr. White said, there will be positives. The vast majority will never need our services, but if they do, obviously, we're well equipped for we're essentially back at business as usual these days from a healthcare perspective and ready to serve the community. Like I said, our outcomes have been exceptional, and we are well prepared with any of the needed interventions. Hopefully that helps, Dr. White, answering any questions the Salisbury University community might have. I know it's something that I think about as my daughter's a year away from going to school. So obviously this is a great question, and any information that we can get out there, we're happy to help with.
Steve, thank you again for being with us. We look forward to having your daughter on campus here at Salisbury University, I hope. And at this time, I'm going to take a few of the questions that we've received at the email address. And Eli Maudlin is here to moderate that for us. Eli, what have we got?
Could you talk about how the university plans to monitor compliance and what's going to happen if a student, faculty, or staff member doesn't get their test or doesn't screen?
Well, we have a variety of ways that we are monitoring compliance of testing and screening. Obviously, with testing, we have a list of all the students and faculty and staff, and we're going to make sure that everybody has a test. And we get information about the screening as well. As for compliance, there are a variety of different ways of reporting. On our COVID website, there is a link to report behavior like not wearing masks or if there are parties or things like that. And we encourage people to use that link to tell us what is going on, because as many cameras as we have around campus, we don't always see everything. So we need everyone's help to make sure that everybody is in compliance with the mask wearing and the social distancing.
Dr. White, could you talk a little bit about what's in the safety kits?
Sure. So I actually have a safety kit with me. It has one of these fancy masks in it, and it's got see if I can get it out here. It looks like it's pretty well in there. It's got a thermometer, it's got a safety key for opening doors without touching them, it's got a bottle of hand sanitizer, and it's got a lanyard so that you can attach it to your university ID and wear your ID around campus. We're asking everybody to do that.
Thanks, Dr. White. And can you talk about where people should go if they're looking for the most up-to-date information regarding what SU is doing to help slow the spread?
Sure. All of the information that we have is being posted on our coronavirus website. There's a direct link from the SU homepage. And in fact, we have just recently reorganized that website. You can imagine that over the last 6 months or so, it has got a lot of information on it. It became kind of unwieldy and difficult to find some things. So we just finished a reorganization to better organize that information so you're able to find what you need. And so look for our new website at salisbury.edu/coronavirus, and hopefully you'll be able to find everything that you need to keep you safe here at Salisbury University.
And Dr. White, the last question that we have is if you could talk about some of the new services or resources that have been put in place to help support staff, faculty, and students.
Wow, there's a lot. I'm not sure I'm going to remember everything, but what we're trying to do this fall is to come back to near normal operations, but in a de-densified environment. So that means keeping people really apart from each other. And so in addition to all the signage that's around campus now, asking people to do the right things, we have reconfigured all of the classrooms so that they're lower capacity. My classroom that I'm going to be teaching in holds only 18 students now instead of the 40 or so that it used to hold. And so that's so that students are far apart when they are in class. We have signs, things on the floor that encourage people to keep at least 6 feet apart. We have new high efficiency filters in all of the buildings to keep air nice and fresh, keep the buildings balanced. We have expanded healthcare services. We've brought on new healthcare professionals, not only for students, but also for faculty and staff. We have beefed up our counseling center resources. A lot of the sort of day-to-day student health service and counseling services will be conducted using technology, video conferencing, and so forth. So we put a lot of IT resources into place. All of the classrooms have cameras and computers so that students can participate in class via Zoom if it becomes necessary. Any other questions come up?
One more question just came in, and it's asking, could you talk about the key indicators that you're going to be using that you mentioned earlier to determine what level of operation campus will be in and how those things will work together?
Sure. So one of the key indicators, of course, is the rate of positivity on our campus. If we got to a level of positivity that was too high, then even if we didn't make a decision to shut ourselves down, the county health department could shut us down in a moment and send everybody home. So we're obviously keeping an eye on the infection rate on campus. That's going to be primary. But that information has to be taken in the context of positivity rates in Wicomico County, in the surrounding region, and in the state. We have to be in compliance, of course, with all of the rules that come from the University System of Maryland and from the governor's office. We have to, as I said earlier, maintain a good eye on our capacity. If we run out of capacity to help students to stay healthy through student health services or through providing spaces for students to isolate, or if heaven forbid, the regional hospitals run out of capacity to keep people, to treat people with the disease, then any number of those things or a combination of those things could shut us down. But what we'll be looking at primarily is the rate of positivity on our campus. All right. I think that's all the questions that came in. Thank you for listening. Thank you for sending in your questions. Thank you for tuning in today. We will do this every week. If you have questions in the meantime, please send them in to stayinformed@salisbury.edu. I look forward to seeing our students who are moving in very soon, starting Monday. Stay well and go Gulls.